A number of years ago, there was a nurse who I think came into my world through my late wife Judy. I can't remember for sure, but she also dated Dick Springer briefly after his marriage collapsed. So that puts it in the late 90s. And she was a very bright and kind woman. Uh, but I was talking with her when she was telling me about her job. Her job was to go around to doctors and caution them against allowing their patients to get addicted to Oxycontin. And this is long before all the litigation against the Sackler family and so on, but apparently they were conscious that this was a problem, and enough so that they hired her to go around and try and caution doctors. But she told me that in doing that, the doctors, more than one doctor told her, well, what you're asking me to do is to talk with my patients and find out what medications they're taking and how the medications are affecting them, and then go into some depth with them, counseling them to avoid becoming dependent on Oxycontin. And they told her, we don't have time to do that. The insurance company that pays us will pay for 20 minutes. And 20 minutes is just long enough for us the doctor telling her, to set up some rapport with the patient, ask them a little bit about what their symptoms were, and then deciding what medication they needed to treat those symptoms. And the idea of getting off onto side effects or the possibility of dependency, we just don't have time to do that. No time to do that. Well, today I went with my sister, first time I've ever gone with her to the doctor's appointment, and I was particularly interested in trying to get that doctor to help us understand what to do to knock back on the irritable bowel syndrome that my sister suffers from, IBS. She's spending $150 a month on diapers, and she's having this awful repetitive experience of having to clean herself up after there's a big mess in her diaper. And I'm confident, although I don't have a lot of evidence to back this up, but I'm confident that this is something that would drain you out as far as nutrients and vitality over time, having diarrhea all the time. So we asked him about that, and he had his medical assistant at the beginning of the appointment, before the doctor came in, go through with my sister and looking at her chart and saying, well, I see you've been prescribed this medication, this medication, this medication. And are you still taking this one, or are you still taking that one? And when the doctor came in, he started going through the same thing. And by then, I got a chance, or Karen, my sister, told him, I'm concerned about my IBS and if there's something I could do about that. So he began talking about what he said is called in the trade pharmaceitis, I think he said. If you're taking anything over 5 prescriptions, you may have pharmaceitis. Well, she was at 12, I think, and when he went down through it, finally, when she told him she didn't take this one or that one anymore, he said he'd gotten down to 9. And but then he went down further, and he identified 3 antidepressive medications: Zoloft, Wellbutrin, and another one that's a long name that I don't know what that is. So we asked him then, could any of these medications possibly have a side effect of irritable bowel syndrome, diarrhea? And he said yes. He said that it's very much information in the field that those medications could cause a bowel upset. And then he started zeroing in about these 3 that she's prescribed. And eventually, by the end of our consultation, he, I thought very adroitly, got her to agree that the Zoloft, she would cut back from 2 pills a day to 1. And then after a month of seeing how that went, if she could, to drop that 1. And he said, when you come back in 3 months, I will review this. But he said, if you can get off of it by yourself, that would be wonderful. And as we were walking out to the car, I couldn't wait to ask her, Karen, has any doctor ever told you that these antidepressant medications you take could cause irritable bowel syndrome? She said, no, no one has ever mentioned that. And she's been taking antidepressant medications for many years, maybe 20, maybe longer, I don't know. But not one had talked to her about this could be causing this irritable bowel syndrome you're suffering from. That's why I started out by talking about the nurse who was trying to get doctors to be careful with Oxycontin and was being told by the doctors, we don't have time. And toward the end of our consultation with the doctor today, he said, well, we've run over quite a bit and I've lost over half of my lunch break now, but this is important. Well, when I got out to the front desk, I asked him how we scheduled the next appointment for 3 months. And I said, well, how long do you schedule these appointments for? They said, 20 minutes, 20 minutes. So he'd been with us for 40 minutes. So he overran the time by double in order to get at this very major concern that he was glad to see he had some people that wanted to deal with it, and he was willing to spend extra time to help with that. I'm very impressed with him for doing that, but I'm alarmed that he's only scheduled for 20 minutes because it rings in my ears about doctors telling people we don't have time to really talk about anything other than what are your symptoms and what new pill am I going to prescribe. So our system is screwed up.